Very good morning to all of you. So I'm back with my lectures again. Myself, Dr. Manjari Kishore. I'm Associate Professor in Pathology. And today, before starting our lecture, wishing you all a very happy and colorful and safe Holi. So today what I decided is we'll start with anemia. So let's begin with what it is finally, and I'll be taking subsequent lectures highlighting different types of anemia, the different morphological type, the functional type, how we divide it. So anemia, it is a very common terminology which you hear while seeing a patient, whether be it in MBBS, your rounds, OPD, everywhere. When you examine a patient, you study your MBBS throughout MBBS tenure, this word anemia, it is very important. इसके बारे में जानना है क्या, ये pathogenesis क्या है, and how you diagnose this entity and how you move further for it. ठीक है? So anemia is what? Basically हम anemia मतलब क्या? ठीक है? It is decrease in the competence of our blood to carry oxygen to the tissue. जो ब्लड होता है वो ऑक्सीजन को कैरी करता है टिश्यू तक. सो अगर उसकी कैपेसिटी में फंक्शनल इंपेयरमेंट हो जाए, दैट इज योर अनीमिया. और अगर ऑक्सीजन नहीं पहुंचेगा टिश्यू तक, सो व्हाट इट रिजल्ट्स इनटू हाइपोक्सिया. And it is, when you see technically, it is decrease in normal concentration of hemoglobin or erythrocytes. ठीक है. एंड दिस इज मोस्ट, एज आई सेड, बहुत ही कॉमन टर्मिनोलॉजी है जो आप लोग सुनोगे. सो दिस इज अ मोस्ट कॉमन प्रॉब्लम इन आवर क्लिनिकल सेटिंग. So before we delve into different types of anemia, my today's lecture is basically to give you an insight of what it is. So normal erythrocyte, जब हमें देखना है कि how anemia develops, so उसके लिए what you have to do is you have to know what is normal erythrocyte kinetics. So एक फॉर्मूला आप देखो, m is equal to p into s, where m stands for your total erythrocyte mass in a steady state in our body. P is the new erythrocytes produced every day. S is the erythrocyte lifespan. So for this new erythrocyte produced per day, we have to know क्यों होता है, क्योंकि erythrocyte जो RBCs होती हैं उसके एक particular lifespan होती है 100 to 120 days. तो उतने में वो RBC जो होता है वो destroy हो जाता है. सो उसके लिए, बट एक स्टेडी अमाउंट को मेंटेन करने के लिए तो हमारी बॉडी को क्या करना पड़ेगा, न्यू एरिथ्रोसाइट प्रोड्यूस करने होंगे एवरी डे. ठीक है. सो एग्जांपल लो, एक 70 kg मैन है विथ 2 liters ऑफ एरिथ्रोसाइट मास. सो एमपीएस में फॉर्मूला में अगर 2000 ml उसका वो हो रहा है 2000 color. So see, this is total erythrocyte mass is suppose 2 liter, that is 2000 milliliter. And for this to, and we know RBC survival, this suppose we are taking it as 100. ठीक है, survival period of RBC. So इसको maintain करने के लिए कि हमारा जो mass of erythrocyte है वो भी 2 liter रहे और survival days जो है हमारे RBC के वो 100 days रहे, उसके लिए हमें 20 milliliter of RBC should be produced per day to maintain this ratio. So अगर सपोज इस फॉर्मूला में सर्वाइवल अगर कम हो जाती है आरबीसी की, सपोज हिमोलिटिक एनीमिया जहां आरबीसी डिस्ट्रॉय हो रहे हैं, ठीक है, तो उसमें क्या होगा, 2 लीटर को मेंटेन करने के लिए हमें प्रोडक्शन को बढ़ाना पड़ेगा. ठीक है, गॉट इट. सो दिस कम्स हियर. Suppose our RBC survival rate is days are reduced to 50 days. So to maintain this 2000, this is static. Steady state में we need 2000 milliliter of RBC. So we have to produce 40 milliliter per day. So 20 से 40 हो गया production. ठीक है. अब ये होगा कैसे? So for this our bone marrow has to work. But even if एक limit तक ही bone marrow act कर सकता है. If a marrow is not able to produce RBCs on adequate basis, how much it is needed, फिर RBC survival जब decrease हो रहा है उस समय अगर marrow नहीं compensate कर पाता RBC का production, तो RBC mass हमारा maintain नहीं हो सकता है. ठीक है. Then what happens is anemia develops. So in two condition anemia can develop when RBC are destroyed at a very fast rate, ठीक है, in which the capacity of bone marrow is not able to maintain it. Second is your bone marrow production is impaired because of many reasons. We'll see gradually. So now something about when you evaluate a patient for anemia, जब आप देखोगे, जब आप general examination is an important part. So anemia is an important point which has to be always examined properly. So उसमें हम पहले पेशेंट की हिस्ट्री से शुरू करते हैं. We have to ask the patient about their dietary habits, any medications they are on, or they have been exposed to certain kind of chemicals or toxin. What is the symptom and duration of these symptoms? So symptoms are iske. Symptoms are those features which patient will tell you. Fatigue है, muscle weakness है, headache, vertigo, syncope, dyspnea, palpitation, change in color of the urine. They say urine is becoming dark or red in color. The previous record of any abnormal blood examination, family history of abnormal blood examination. So this was symptom which will be told by your patient. Then when you examine the patient, physical examination में, how you see anemia, you have to look for skin pallor, pale conjunctiva, koilonychia, hypotension, jaundice, smooth tongue, neurological dysfunction, hepatomegaly or splenomegaly, any bony deformities in congenital anemia we can get. Gallstone also appears, extramedullary hematopoiesis. So these are the signs of anemia which we can note by physical examination. Then comes for evaluation of anemia through laboratory parameters. So what are the different lab parameters which can help us to lead to a diagnosis of anemia? I'm just giving you an overall picture what we use to arrive at a diagnosis of anemia. RBC count करते हैं, hemoglobin, hematocrit, RBC indices which are MCV, MCH and MCHC, reticulocyte count, reticulocyte production index, corrected retic count, immature reticulocyte fraction. Blood smear examination करते हैं, leukocyte and platelet quantitative and qualitative examination. Then we also look in detail in the peripheral smear. We'll look for presence of spherocytes, cystiocytes, poikilocytes, RBC inclusion. And see RBC destroy हो रही है, तो उसके लिए भी हमारे पास बहुत सारे टेस्ट होते हैं, लाइक सीरम बिलिरुबिन, हेप्टोग्लोबिन, हीमोपिक्सिन, LDH that is lactate dehydrogenase, methemoglobin, urine hemosiderin, fecal and urine urobilinogen, blood in urine. And finally we have to go for bone marrow examination also. So see, this हमने देखा clinical symptoms and signs है, then laboratory parameters है, then we have to classify anemia. तो उसके लिए हम morphological और functional classification, जब भी हम anemia classify करते हैं, so what we require, certain parameters are required to categorize it into different types of anemia. See, anemia is what? Anemia is not a disease. It is an expression of an underlying disorder. And so treatment of anemia without knowing its cause is devastating. क्योंकि फॉर एग्जाम्पल अगर पेशेंट को आयरन डेफिशिएंसी अनीमिया है बिकॉज ऑफ क्रॉनिक ब्लड लॉस, some GI bleeding is going on inside, fine. So even if we give iron or blood transfusion, hemoglobin क्या होगा, थोड़े टाइम के लिए राइज करेगा, but it will not correct the primary disease which the patient is suffering from. And then what happened, उस primary disease के complication बढ़ते जाएंगे और हमारा anemia भी bounce back कर सकता है, ठीक है. So it is necessary to identify and understand the etiology and pathogenesis of anemia to give a correct diagnosis and treatment to the patient, which is most important. ठीक है. So certain parameters है जिसके basis पे हम classify करते हैं. CBC parameters हैं जैसे average size, hemoglobin concentration, RBC indices like MCV, MCH, MCHC, reticulocyte production index, immature reticulocyte fraction. So in iron deficiency what happens is RPI or IRF हम use नहीं कर सकते, तो we go for serum iron studies because those values are variable in iron deficiency anemia. So see, this I have summarized in a table. So जो हम ये सब parameters use कर रहे हैं to classify anemia, तो हमारे जो morphological basis पे क्या होता है, macrocyte जिसमें RBC की size बड़ी हो रही है, then we have normocytic normochromic anemia जहाँ size and shape maintained है, then we have microcytic hypochromic anemia where RBC size are reduced. So जब macrocytic है, जब MCV more than 100 है, size बड़ी है RBC की, if we categorize the different cause why anemia is happening, we can take, see, reticulocyte production index अगर more than 2 है, then means survival defect हो रही है, ठीक है, तो hemolysis और hemorrhage में. Then RPI if it is less than 2, then certain megaloblastic causes with nuclear maturation defect. So उसमें what different cause of anemia can be, B12 deficiency, folate deficiency, drug induced, congenital disorders, myelodysplasia. When RPI is less than 2 and it is non-megaloblastic, so we can have proliferation, maturation, survival defects. Here we notice it in these disease, chronic liver disease, alcohol abuse, endocrinopathy, aplastic anemia. Then coming to normocytic normochromic anemia, उसमें अगर RPI more than 2 है और RPI less than 2 है, ठीक है. So अगर RPI more than 2 we had seen now it is due to survival defect, तो वो hemolysis hemorrhage में बढ़ता है, ठीक है. Then RPI less than 2 is proliferation defect. We notice it in marrow damage, stem cell defects, chronic renal disease, endocrine hypofunction, chronic infections or inflammation, liver disease and malignancy. Then our third type morphologically it is microcytic hypochromic anemia. So serum ferritin levels देखते हैं, अगर वो decreased है, cytoplasmic maturation defect, it goes in favor of iron deficiency anemia. If serum ferritin is increased, so we have different disorders like chronic disease, thalassemia, hemoglobinopathies, sideroblastic anemia, lead intoxication and porphyrias. So this morphological classification जो हमारा है, it uses basically what I said, RBC size, hemoglobin content, MCV, MCH, MCHC. Functional classification combined है, absolute retic count, corrected retic count, IRF, serum iron studies.